how to deal with the death of a patient, the first thing is like self-care. Like you need the time for yourself, that balance. Just like we say, find a hobby, find something that you could like de-stress on, and take that energy away from like that negative environment.
There's no like protocol for how to deal with a patient death. There's no book or little hand guide. Step one, do this. Step two, do that. Step three, sleep. Step four, go talk about this with somebody. It's not like that. It's not that easy. Everyone has different emotions, and different emotions come up in different ways, different situations, and we just have to kind of learn from our own experience. The way Matt deals with a patient dying is gonna be different from the way I deal with patient dying, right? Same thing goes with the way a hospice nurse deals with patient dying compared to a new grad, right?
Yeah.
Completely different. It's something that we keep saying this, like you get desensitized to it, but that's kind of like that's that's like a kind of, you could say, a shallow way to look at it. But for some people might think that. I don't, because that's just like the truth for it. I'm not gonna sugarcoat anything. It's just you get desensitized to it because it happens so often where you kind of already know what to do. It's almost like robotic, but the work is robotic. The postmortem care is pretty robotic. But the thing that always changes is the family aspect of it. You're always going to approach a family different than the next one, right? Because some family members seek different things. Same way you talk to the patient's sister differently compared to the way you would talk to her brother, right?
I would also mention, because you said like robotics, so like let's just say your patient just like passes away and the doctor calls a code, right? You do have that like moment of grief where everybody looks at each other in the eyes, looks around the room. We know we did a fabulous job. Everybody did their hard work. Unfortunately, this is what happened, and we have that moment of grief. Like we still we still accept these emotions. Like we don't like just like suffocate them. Like, oh, like dying is part of the world. Let it be, right? Like we still accept those emotions in that given moment. We grieve, but we put it aside because it's just, you can't do anything else with it. You could grieve forever. You just have to accept it, right, and just move on with your shift in a way, and that becomes easier. But you still are going to experience that emotion. It's up to you to choose how long you want to experience that.
It's crazy. For every patient that has died, like not necessarily on me, but like died just like in a hospital where like I've seen pass away, right? Like I always have like this moment where I mean I always get it. I don't know why it just happens where it's just like not really like not really, well, I'll put it this way. So basically I get like this emotion where it's like one day this could be me, not necessarily like in that person's situation, but like dying, right?
Yeah, of
I always
course.
have that kind of like a feeling, and then I always take a deep breath, and then while I'm doing like postmortem care, even though I'm not the most religious person, I always say like a little prayer in my head, and I like hope that the family remembers that patient for his good times, not necessarily his bad. Just a little protocol that I do for myself, and that's kind of how I always work with it, and it's just like I want to say I've seen maybe like 7 to like 10 deaths. I want to say these past like 4 years almost, and basically do that little protocol each time. And
Yeah, it's
like it's
really
not like
cool.
I don't like it just happens subconsciously. Like I just go into like the those phases, and it's just I'm just like damn, did it again. Like I catch myself,
Yeah,
I'm like damn, I'm doing it again.
that
But
that's
it's
that's
pretty
your way
interesting.
of kind of dealing with things.
Yeah, it's pretty cool. Well, yeah. But another tip that we could offer you guys for kind of dealing with death, besides like practicing self care, that's probably the most important one out of all of them. But you know, it's also okay to kind of feel relaxed or almost happy that the patient has passed away, because there's been too many times where we've seen patients struggling in a hospital for months at a time with
We talk about this a lot.
yeah, and we know there's really no hope, but the family keeps saying, keeps pushing, keeps pushing, keeps pushing, and you know that the patient's struggling because you're doing sedation occasion, you're trying to extubate him, and his patient's like hanging on by a thread. You don't want to be too aggressive because you know that the patient is gonna die, so you're being aggressive enough to meet the family's needs, but you're not being aggressive to the point where basically your strong action, strong push, strong process is gonna end up, I want to say killing the patient, but push them too far.
And we could both right now say that we know a patient right now in the ICU that like is going through something like that.
Yeah.
And when that patient, passes away, God forbid, I'm gonna feel a little bit joyful in a way because
Hmm.
that patient went through a lot of suffering, taking care of him, putting a dub hoff in his nose. you know what I mean, turning him and seeing him in excruciating pain,
Mm,
it's going to be a sense of relief to see that person in another, state of consciousness, right? Let's just
mm,
say that. And the mother beginning her grieving period because she finally made peace with like the situation, because if you were to look at the dynamic, the patient is, very sick, and the mom is holding on for dear life because she's thinking there's a way for, all this to go away. So yeah, it's a joyful moment because two people are going through a different part of life now.
mm. It's relaxing, like you seeing somebody. There's a difference between seeing somebody pass away naturally with like family in agreement, being okay with the process, and then there's another feeling that you get when you know the patient's family is forcing on it way too much for the patient. You kind of know that the patient would not want this,
Yeah.
but the family has the last say, and that's kind of what's going to be, because yeah, you do, like, we don't know what happens after we die, right? We don't as
Such a
far,
freaking mystery.
right? We don't. If maybe there's people out there that do, that they don't want to tell anybody, but I don't, and I'm sure as how Matt doesn't, because if he knew, then we'd be in a whole different situation.
Man, we would tell you probably.
Yeah, and then the fact of the matter is, we don't know what the hell's gonna happen when we die. It could be another life, a longer life. We could get reincarnated. We could go to heaven. We could just, it could, as far as I know, it could just be nothing. That's it. That's
Yeah.
a pretty scary thing to think about. It could be basically nothing. This is it. This is your one shot. It's one chance. But it's not the point. Like, the thing is,
We're about to
like,
turn this podcast episode to what is life?
right. The thing is, like, it's okay to feel happy. Don't feel weird. Like, don't be like, why am I happy this patient died? Because it is a natural occurrence. People are going to die. You can't stop that. And like, feeling happy is like a normal instinct. Like, I felt happy for a few patients that passed away, because I know that they passed away already, and they passed away the way they wanted to, like calm and peaceful without any conflict or anything like that. And that's really rare to see.
And that's one of those things as a nurse you always want to advocate.
Mm,
Sometimes you advocate for the wrong things, but you accept the, the wishes of the patient and stuff like that, and things go on. And that goes into like the next thing. Like, remember, like, that these things, happen. Just give your most attention to it, most compassion, and learn to compartmentalize the situation and feel that emotion and just kind of like move on. That's like the best advice I would have for anybody out there listening.
but you can't be that person that says, "Oh, well, if it happens, it happens." Like,
Of
like,
course.
you can't have that kind of uh perspective and personality either, because that's kind of like, I want to say weird, but it's not something you should have as like a nurse. Like, carefree, whatever happens, happens. Death is normal. Yeah, it passed away. Who cares? You're gonna pass away too. Everyone's gonna pass away eventually. And that's kind of not the right. If you can have that perspective, that's fine. It's whatever you want to do with it, but it's not a good idea to kind of show that around the family.
Yeah,
You could show that around like your coworkers and all that. That's fine. But patient care wise, like, when someone's dying, you should for sure, not kind of, you should 100% accommodate to the patient's needs.
yeah, meet their energy in a way.
Exactly. And if they're religious, you don't have to be religious, but just don't laugh at whatever they're doing. Don't make fun of them if they're singing, whatever, because they're different religious subgroups that maybe they view death as joyful, right? So they might be singing, family might be happy. Don't be like, oh, there's a bunch of loonies singing and dancing over their uncle's dead body. No, it's just the way they express themselves during like a death of a loved one.
Yeah, when I say remember that it happens, it's more about that blame game with like nurses, like that blame game that kind of takes over. I would also say that like sometimes we also like we as like nurses, because we kind of like mess around and joke around and stuff, like don't forget, like, if a patient passes away there, like just kind of keep it down for a little bit, for an hour or two.
Mm.
Be respectful of it. Like, of course, you're running the unit and stuff like that. I could do whatever I want, but just be respectful for that little time being. So when that family member comes around, it's like you're just meeting their energy and their atmosphere for now, because that's what they need.
Yeah.
That's what they need at that moment.
And also remember that you're making a difference. Yeah, the patient might have died. It sucks. It's very sad. It's very hard. But just know that everything that you did during that shift or during the patient care doesn't go to waste just because the patient died. Like, this is a lot of things that we nurses do go unnoticed, but realize that, like, the energy that you provided in that room to that patient, like, that's being broadcasted somewhere, and eventually it's gonna come back to you. Like, I'm not saying like karma, things like that, whatever you want to believe in,
The
but like, it's,
universe.
yeah, just because it goes unseen and unnoticed doesn't mean it doesn't count for anything, right? At least if nobody sees you do a good job, like you as a person know you did a good job and you know you cared, that should be enough to make you happy.
Like, yeah, I'm that nurse. Hey, I go in there, I give him 100, and that's all that matters, right?
Yeah, because because let's say you do something extra each time, just because you don't get noticed each time you do something extra, guess what? That one time out of 100 when you do get noticed, you're gonna feel a lot better,
Oh yeah.
right? And especially like family might not remember you during like the patient's most critical time, so they might not remember you hanging pressers, they might not remember you running around the room, but what they will remember of you is you helping them through the grieving process, you taking care of their loved one when he passed away, you being there when he literally passed away. That's what they remember you for. They're not gonna remember you doing like all this technical nursing stuff where you're calculating drips, hanging one, discontinuing the other, giving fluids. They're not gonna remember you for that because they don't know what the hell's going on. But they will remember you when you talk to them when their loved one passed away, when you say, I'm sorry for your loss, when you say, is there anything I can help you with? Why? Because they can relate to you in that kind of level. They can't relate to you when you're hanging drips.
It's just like the patient that you just like ran around, called the doctor for, like you caught an error that could have potentially like, caused some harm to them, yet you forgot to bring them their tea and they're freaking kind of shitting on you for that. You know what I mean? That's the stuff that gets unnoticed. But just know that you're amplifying this goodness into the world, and it'll come back in one form or the other if you believe in that. I really do believe whatever you put out to the universe, you kind of get it back. That's just kind of how like the law of attraction works, right? Which is talked about.
And a fifth tip for you guys, another good one, probably second self care, but also goes along with self care is talk about it. Like if your first death, if your first patient death was detrimental to you, like the best thing you could do is use your nurses, use your coworkers to talk about it, because they've been in your shoes more times than you. Especially if you're a new grad and your first time experiencing death. Well, guess what? If you experience death for the first time, let's say 1 month into being a nurse, imagine how many times the other nurses around you have experienced it, right? And you guys for sure have the same emotions because nurses, we all have similarities, right?
Yeah.
And we all are similar on some type of level, and we don't shut down anyone's emotion. If a nurse came up to you that's having a hard time processing the death of the patient, even though it might be easier for you and you kind of know how to do it personally, you're not going to give shitty advice. You're going to try to be there as much as you can to help the nurse because you understand when your patient died, you understand how we're not very emotional people. I mean, we're dudes. We're not the emotional guys in the world.
Even though
But
most of our listeners are female, so
yeah,
maybe this is our struggle instead, right?
yeah. But like you could understand why this nurse is emotional, right?
Of
Like just
course.
because you didn't feel his emotions, you understand because we're pretty like intellectual and pretty
Yeah, we're empathetic.
empathetic,
We're able to feel too.
right? And are people like when people persons? Does that make sense? Or peoples? I don't know which way you would say that.
Sounds good either way, man.
Right. But like just because you don't experience those emotions, you kind of have an idea how those emotions would feel, right? So you're able to give advice, you're able to be empathetic to that nurse that's coming to you for advice from a dying patient. You don't just close her off and say, well, I've seen 4 deaths and I got through a fine, you'll be okay tomorrow. Like you wouldn't say that, right? You would say you offer some advice relating to her emotional issues, right?
Yeah, that's like the worst thing that people hate is also like you telling somebody, and instead of them acknowledging your feelings and maybe saying something, they're just like, well, they try to fix you right away. That's not.